Hi, I'm Dr. Tommeraasen, colorectal surgeon at Paragon Surgical Specialists, and I will be talking to you about colorectal cancer. So colorectal cancer occurs due to just an abnormal overgrowth of cells within your colon or your rectum, depending on where the cancer is at. There are certain groups of patients or people who are at higher risk of developing these cancers. This includes patients that are older, patients with a history of any sort of polyps, patients who have a previous diagnosis of Crohn's disease or ulcerative colitis, and then also people who have a family history of colon or rectal cancers. Colon polyps are growths of tissue that are found in the lining of your colon. These are commonly found during colonoscopy. There's many different types of polyps, but most commonly they're benign overgrowths. It's important to detect these early and to remove them if possible, because if left unchecked, they can turn into cancer. So there are multiple options available for colorectal cancer screening. The most commonly used way of doing this is colonoscopy, but there are also stool-based tests available, and then also imaging studies that can be used as forms of screening. If a modality other than colonoscopy is used and there's concern for colon or rectal cancer based off those, it's recommended that people get a colonoscopy. So there has been a rise in cancers being detected in younger populations, and recently there's been a change in the recommendation on when we should start searching for colon or rectal cancers. The current recommendations are that you start colorectal cancer screening at the age of 45 if you're considered an average risk. These are people who don't have any previous history of polyps and don't have any other family history of colon or rectal cancers. There are some people that are at higher risk. These are people who have a family history of colon or rectal cancers. For these people who have a higher risk, it's recommended they get their screening started at an earlier age. The age that it's recommended for these people is 40 years old or 10 years before their family member was diagnosed, whichever comes first. There's a lot of different ways that colon and rectal cancer can be treated, and commonly it involves multiple teams of medical specialists. The colorectal surgeon is certainly part of the team, and this approach to treating each cancer is individualized. My role within this team involves discussing and deciding on what the best surgical options are for the patient. I do offer minimally invasive surgery to help treat their cancer. This includes robotic surgery and laparoscopy. And then I do also utilize open surgeries as well if I think it's necessary. If you begin experiencing symptoms such as change in your stool habits, blood in your stools, I highly encourage you to go see your regular doctor, or if you have any concerns about this issue. So I encourage you to proceed with your colorectal cancer screening in a timely fashion. By doing so, there's a better chance that if there is a colon or rectal cancer present, we catch it at an earlier stage where it's more treatable.